Here's how to use a COVID-19 home testing kit and find out your results in minutes. First, collect your sample. Insert the sterile swab into the nostril and rotate 3 or 4 times against this area of the nasal passage. Then take it out. Next, prepare your sample. Insert the swab into the tube provided. While squeezing the tube, stir 5 or more times. Remove the swab while squeezing the tube to extract the liquid. Once out, fit the nozzle securely onto the tube. Next, perform your test. Place the test device on a flat surface and apply 3 drops of the extracted sample at a 90-degree angle. Finally, check your result. Read the test between 15 to 30 minutes later. Do not read the result after 30 minutes as there's a risk of an incorrect result. A colored line should appear here to show that the test is working properly. Even if the control line is faint, it's working. If no line is visible, the test is invalid. In the case of a positive result, a colored line appears here. This is the test line. Again, even if the test line is faint, it should still be considered a positive result.